Hello, I'm Dr. Brant Gibson, and tonight I want to talk to you about vascular studies for peripheral neuropathy. And I just started to post this video and it failed because of lack of sound. So I'm starting over with the hope that you can actually hear me this time. The idea, why would you do a vascular study? There's multiple different reasons why you do vascular studies. You can check blood flow, for example, to the extremities, to the feet and the hands, to the fingers and the toes. And that can be done through pretty significant studies like sticking a needle in, putting contrast in, and doing imaging. But a non-invasive way of doing that is through the use of ultrasound and cuffs, blood pressure cuffs, where you can actually check the value at each of the levels. So you can actually say, okay, do I have pressure at the legs and the feet and so forth? And you actually determine how good the blood flow is going from the heart down to the feet or the heart out to the hands. The advantage of doing this in neuropathy is blood flow can be a big problem in certain types of peripheral neuropathy. For example, autonomic neuropathy can actually affect the blood flow. A diabetic type neuropathies can affect the blood flow. And when you decrease the blood flow, you decrease the nutrients that are getting to the nerves. And in doing so, you actually have weaker nerves and you have nerves that start to malfunction and not work like you're supposed to. One of the tests that we will commonly do as part of this non-invasive vascular studies is the ankle brachial index. The idea of the ankle brachial index is that it's a test that compares the blood pressure measures at your ankle with the blood pressure measures at the arm, and you expect it to be close to 1. If it's low, then it actually indicates that you have a blockage of the blood flow down to the legs. If it's high, a lot of times it indicates that you have calcification of the vessels, and that can also be a problem. So when it comes to peripheral neuropathy, one of the tests you should have done, you should have your doctor do, is to evaluate the blood flow so that we can determine if the nerves are functioning like they're supposed to, or better yet, if they're getting the blood flow they need so that they can function the way they're supposed to. This is Dr. Brant Gibson, and this is your Neuropathy Nugget Day 259. Vascular studies for peripheral neuropathy. Thank you. Have a great rest of your night.